When I talk about breast augmentation, I like to talk about 4 main variables that allow me to customize the operation to your specific needs, and importantly, help me explain every little nuance of this procedure to and for you so that when you go into it, you know everything you need to know. You have a clear idea of what's happening, and there are no surprises. Guys, I hate surprises in surgery. Let's get away from that. So the variables are the type of implant, type of incision, position of the implant above or below the muscle, and then the size and shape of the implant. So let's start with number 1, the type of implant. In general, there are 2. There's silicone and saline. The reality is at this point, most surgeons will use a silicone implant, and that is essentially what I exclusively use. Now, in the world of silicone, there are multiple different manufacturers. There's Allergan, there's Motiva, there's Mentor, there's Sientra. There are a ton of different types out there, and we tend to focus on specific implants that we know very well. Within those categories of implants from each company, they typically have different what we call cohesivity. So some implants are a little more firm and robust. Some implants are quite a bit softer and really less structural. And then there are some in the middle, and we choose your specific implant based on your specific needs, your goals, and everything like that. Now, once we know what kind of implant, what cohesivity we have, then we'll look at the type of incision we use to put the breast implant in underneath your breast, okay? In general, there are 2 that are most commonly used. There's incision around the areola and an incision underneath the breast. Traditionally, some surgeons have also put implants in through the armpit or even through the belly button. My preferred incision is typically underneath the breast, but of course we're going to customize things again based on your specific needs, criteria, and desires. Once we have that figured out, we will then choose where we put the implant in your body. Now, there are multiple different places we can put the implant. Sometimes we will put the implant in directly underneath the gland of your breast and above your pectoral muscle. Sometimes we'll put the implant in underneath the pectoral muscle, and sometimes we'll do what's called a subfascial approach, where we put the implant above the actual muscle but underneath its fascia. A fascia is a covering of the muscle. Think about it this way: a sausage has a casing and the meat underneath, so does muscle. So we put it basically underneath that casing of the muscle, but still above the muscle. And there are different advantages and disadvantages to each of those approaches. I think it's important to talk about it because the pluses and minuses include things like the incidence of capsular contracture or scarring around the breast implant, the presence or absence of what we call an animation deformity, where when you put the implant in underneath the muscle, when you flex that muscle, it may move and just displace the implant. Now, an important thing about placing an implant in underneath the muscle is how we treat that muscle. We often do what's called a dual plane approach, where what we'll do is we just release a small portion of the pectoral muscle that inserts just onto the rib cage, but keep the pec muscle attached to the sternum. That will allow a release of the lower aspect of the breast, allowing that implant to take a nice rounded shape all around there, because imagine if that pec muscle is under that lower aspect of the implant, not going to look too good, but if you release it down, it has a beautiful contour. So, patients who have a purely subpectoral breast augmentation, no one does that anymore, or more importantly, a dual plane breast augmentation where it's partially under the muscle, they may have that animation deformity. So there's a lot of things that go into that. Once you have decided on the placement of your breast implant, then we'll talk about other adjunct treatments like using a mesh to help support the implant up so that we can prevent it from drooping down over time. Because listen, gravity exists always, and you want to sometimes help support the implant so it doesn't drop into a place that it shouldn't go, certainly down or even out to the side. Next, When we consider breast augmentation, the final variable, there's the size and shape of the breast implant. So the most important thing in picking a breast implant is that I want it to match your body's very specific anatomy. So I'm going to take tons of different measurements from you. I measure from the sternum down to the nipple down to the bottom part of the breast. I measure the width of your breast. I look at how much breast tissue you have. We take a lot of these things into consideration. I think one of the most important measurements is that width of your breast, because whatever the width of your breast is, I of course want your implant to be just about the same width. We don't want it to be too narrow because we don't want it to undersell you, and we certainly don't want the implant to be too wide because we don't want it to go out to where it doesn't belong and doesn't look natural. So once we know the width of the breast implant, I know that for any given width, the implant companies will then make multiple heights or projections of breast implants where I can actually dial in how much that implant sticks out, and that will go in line with a very detailed conversation that you and I are going to have about the aesthetic goals you have. So we're going to look at pictures. We're going to talk about what type of result you want. And together we're going to pick an implant that has the appropriate not only width, but projection to get you that goal. And we will custom fit that implant to you. Now, one important detail and one thing that I do to really customize the operation to your end is we'll plan on a certain range of implant size and profile, again, low, moderate, high profile, for example. And then I will have a broad range of implants available to me on the day of surgery. On the day of surgery, I'm actually going to use what's called an implant sizer to just perfect the nuance of your breast size. So we'll go in with a range. I put in the implant sizer. I blow the breast up to a goal that I want. We may go a little higher, we may go a little lower, we may choose different sizes from left to right, and we will find the perfect and appropriate breast implant size just for you. Because remember, breasts are different. Breasts do react differently when there's something in there. So we want to make it as customized to you as possible. So once we have explored those options for the breast implant, type of incision, position of the implant above or below the muscle, and then the size and shape of the implant, we're going to do one last consideration. And hey, what does the breast look like? Because in some cases, some patients have a breast that is a little bit droopy, and we may then need to talk about a breast lift. That's another conversation, but we always consider the global picture of your breast rather than just, hey, let's make it big, okay? So we do all that planning before surgery. You and I have a very specific conversation about your aesthetic goals, and we will get you into the operating room with a confidence in your goals, with a confidence in what we are going to do, and we will get you to a place that when you wake up and look down, you say, this is what I wanted. I hope this cleared up the picture of how we get you to a breast augmentation. If this is interesting and you want to learn more about plastic surgery, follow me on this channel. We'll show you everything we can.